South Africa is the epicenter of the global HIV/AIDS epidemic. The Ithembela Bantu People's Hope Clinic is commemorating 10 years of service from 2001 to 2011.
Well, today we are commemorating, get together with our first 200 clients that we treated in this clinic way back from 2002. So it is a very important occasion because it shows that the work that we are doing has saved lives.
The patients will share with us also the success stories which they've gone through with the treatment, and would like them to urge other members of the communities to get tested and get access to medication.
And I think the day I left the hospital, the doctor sent me home to die. Today, I have a minus 50 CD4 count, viral load, and 3 months ago my CD4 was 165. I can get up in the morning and see to my kids. I can prepare their breakfast. I can supervise homework. I can work, and most of all, I can be around at least that my children see adulthood before I leave here.
I think in the 9 years, when I reflect on what I've been able to do, it brings me a lot of joy. In fact, this weekend I was married, so that's even more joyous. We're very thankful to the AIDS Healthcare Foundation for coming to South Africa, for giving us the opportunity to live, and for staying with us. And we're very proud of how far they've come, and we're very happy to be part of that AFH family.
Such an opportunity that this clinic has given to us over the past 9 years, to be precise. So today, for me, it is quite an important event to be able to come together with my peers, with my friends, with my colleagues and family, to be able to come together and celebrate what this organization and what Ithembela Bantu and ARVs have done for us.
In that time, my CD4 count was about 140. Fortunately, I was not ill. I had only headaches, and my feet were very, very sore. And then Dr. Masuke gave me a call to come here at Ithembela Bantu to start the treatment. And then they gave me this treatment. From that time, my body is okay. I'm well. I don't sick. I don't get anything. I'm okay.
My mother is HIV positive. She has been HIV positive for the past 17 years, but I am 13 and I'm HIV negative. When my mother gave birth to me, she thought it wasn't possible, but I am living proof of that. And with God's mercy, I am HIV negative, and I thank the Lord for that.
People are still not checking HIV. They must see in us. We are delivering proof. We can see that we are delivering proof. I'm taking my medication. I'm okay. I'm still alive. Another 10 years I'll be celebrating here. Yeah.
And I've seen patients getting better all the time, looking better, getting married, and some finishing their studies, and some going back to work, because those days our patients were very sick and they were not working. And most of them are employed, which is also a positive thing for the clinic and for us.
Despite government resistance, the Ithembela Bantu People's Hope Clinic opened, becoming the first free HIV/AIDS treatment clinic.
We also want to assure people that we are not going anywhere yet. We're still going to be providing free testing, free treatment, medical care, and all the other services that we're providing regardless of the ability to pay. In the celebration, we are honored to have our partners around, the people that we're working with around Umlazi. There's traditional healers, we've got our senior management, our board of directors members.
Today, the South African government is committed to a more proactive approach to combating the epidemic.
Our very biggest partner, the Department of Health, I think there is a district representative and there's somebody from the Office of the Mayor. We are very, very excited that they have come to witness this. It strengthens our relationship moving forward, and then we can always be heard when we're moving with our advocacy issues to them.
The message to the international partners, HIV/AIDS is still a big challenge. Their support is still needed. Fighting HIV and AIDS, of course, working together with the local partners, including mainly the government. The challenge that we have and we know is that the funding is limited. So we need to be able to use these funds cost effectively as much as possible so that we can reach many clients and save more lives.
We would like to thank the LA team for the support that they've given us ever since we started preparing for the celebration. Also the staff in the clinic, they've been very, very supportive. Our senior management, senior management in LA. I want to thank and continue motivating the group that we're celebrating today. They've gone this far from 2002, so life continues, and there will also be a very great motivation to the other people that have just started ARV treatment, that it does happen. You can always live a healthy and fulfilling life after discovering your positive status.